Good afternoon, everyone. I'm Dr. Legzan Thapang. It's indeed an immense pleasure and an honor to be able to speak few words in front of you all on this occasion of World Stroke Day 2022. I would like to thank Dr. Bhupi and team along with Professor Sanjeev Sharma for allowing me to speak few words which could be very important and helpful to you all. It feels very nostalgic to say that I am from Bpkihs, and on this particular day it reminds me of the history that was created in Bpkihs. So I'm going to share a little bit, a few slides with you all, which would be basically highlighting about the stroke care in Nepal. I've given the topic as Bpkihs, the history lies here, because of the reasons which you will know during my subsequent slides. I'm sure like you all know the facts about stroke care in Nepal. The estimated prevalence of stroke is 2,697 patients per 100,000. This is basically the data from Tarai region, which is from Siddhartha Nagar, and it's a community-based study. And so far we have got only one prevalence study, which was done by Nepal Stroke Association. And the surveillance and monitoring about stroke care is not still available in Nepal, which you all are quite aware of. And the provision of stroke care, if seen in depth, we know that there are 2 stroke units currently running in the country, and both of them are situated in Kathmandu. And there are almost 10 thrombolysis centers in all over Nepal. And thrombectomy is offered by 5 centers, which are more or less in Kathmandu. And stroke care expenses has to be bared up by the patient itself, which you all are aware of, which is one of the very important challenges that we are still facing in terms of providing this advanced or the proper stroke care to the people suffering from stroke. And importantly, if you look at the right corner lower side of the slide, the mortality rate is 18.7%. This is a 5 years experience which Dr. Bhupi and team has published in the Stroke Journal. This is the real scenario that is seen around not only in Bpkihs but all over the country. So in my experience, when we did study in CMS, when I was doing my DM residency, at that time we had ICU mortality of 15%, which actually matches this data. And this shows that like stroke care needs some kind of attention to reduce the mortality related to the stroke. Now the areas that needs attention are public awareness, quality improvement, quality monitoring, and stroke care advocacy. I feel very proud to say that first World Stroke Day was celebrated in 2008 in Nepal, and that was in Bpkihs. I'm sure like many of you have seen, many of you are still, not only have seen, but you are still in this classroom. And this classroom, the thin person who is like standing with that checked shirt is myself, and then the person on the apron on the right side is like Dr. Suche Parik. I think it's Dr. Suche. Yeah, he was a resident then, and I was senior resident. And the person there I can see is like our nephrologist, Dr. Sailendra Shrestha, which I believe is in Biratnagar now. And there were only 6 to 7 people, as far as I remember. There were 6 to 7 people attending this stroke awareness on October 2008, 29th October 2008, during World Stroke Day. So whatever record we have so far, it says that this is the first World Stroke Day that was celebrated in the country, and that too in Bpkihs, and in the same classroom from where we have graduated and we have learned so many things. So that's what the history actually begins in that room and that department of internal medicine, Bpkihs. So the next part about public awareness is like it has grown since then, and in many areas of the country this is celebrated. And World Stroke Campaign or World Stroke Day is celebrated all over the country, including Bhairua in 2006. Some glimpse of stroke care or stroke day awareness part. And then in Janakpura also it was celebrated in 2022. And then if you look at in 2022, many places like in Bharatpur, Bhairua, and lots of other places, they have been doing this public awareness program, especially focusing World Stroke Day, this 29th October, and focusing a different group of people, including like general public, and then auxiliary health workers, CMAs, health attendants, and many medical professionals and non-medical professionals. So to talk about the latest World Stroke Day celebration was in Kathmandu, where Nepal Stroke Association was supported by many major institutions of the Kathmandu Valley, and we had almost like more than 70 people participating in this campaign, where we had a rally, and then we had quiz contest, and we had CME like you all have been doing today. So last but not the least is like the video which I got now is like, this is the video where I can see Dr. Bhupi and the team, a huge team in Dharan, and it feels so proud to actually like see this campaign, and this is actually going all over the country, and I would like to congratulate you all for being a part of this World Stroke campaign together with Nepal Stroke Association. Interesting part is like the basic idea about this World Stroke World Stroke Day is to raise the awareness regarding stroke, and the simple fact, the clear message is learn stroke science and save precious time. That means reach hospital on time. So why this is necessary is because like we know that out of 4, 1 will have stroke. Suppose if we keep our family members or like our relatives or somebody whom we know in line, 1 out of 4 is going to have stroke. So that is very, very serious disease. And these days, stroke is not only like preventable or treatable, but it is curable. So this must be focused while this is what we focus while advocating or while raising the awareness about the stroke in World Stroke Day. Regarding the second point about the quality improvement, in 2016 you can see that all over the country there were stroke care services, but like there were minimal stroke care until 2016 when we started the first thrombolysis in Kathmandu, and after that thrombolysis was taken up. The thrombolysis was taken up by different institutions in Kathmandu, and it has spread to all different places. So this quality improvement or quality of stroke care has improvised, and there are many centers which provide essential stroke care. However, the advanced stroke care is still available only in few centers in Kathmandu. How to actually improvise the quality is basically we have like 5 different approaches which should be integrated together. The first one is the goals. Our goals should be pretty clear, and we should have a stroke team in any centers, and after that the team should be trained by an experienced team, and there should be like a strict or like a standard protocol laid down, and then there should be a huge network so that you actually tell people that yes, this is the center which provides stroke care. And on the same note, we from Nepal Stroke Association are working upon certifying different centers as stroke ready hospitals. So I think like we'll be able to do that soon with the help of World Stroke Organization together. It is very essential, like the work that we do needs to be monitored appropriately, and we have one rescue registry, and I'm sure like many of you, Dr. Bpkihs including many of you know about this rescue registry, and we are already in the process of acquiring this rescue registry in Nepal, and we are going to plan the training which is going to come in soon, and we are working upon it, and I'm sure like I would see few of you participating in this particular rescue monitoring unit. And this actually is the database through which we can monitor that the stroke care is being offered properly to the patients who deserves the right treatment on right particular time. Regarding advocacy, Nepal Stroke Association, as you all know, is advocating about the stroke care not only in Kathmandu Valley or in certain pockets, but all over the country and also all over the world. And on the same note, like we were lucky enough to have our colleagues from University of Heidelberg, Germany, form a project called Nepal Stroke Project, through which we have been able to train many doctors, many nurses, and reach many centers throughout the country. And this is being supported by World Stroke Organization and Angels Initiative. And also this, we have been advocating this particular project, this particular Nepal Stroke Association agenda together with World Stroke Organization support and Angels Initiative with WHO and Ministry of Health Nepal. As you all know, future of the stroke is all about like we trying to develop hub and spoke model of stroke care, and I would say that our Bpkihs is lucky enough to be selected as the first one where we are going to offer help from Nepal Stroke Association with the help in cooperation with WHO Nepal and EDCD and Ministry of Health, where we are trying to help Bpkihs stroke unit to lead province 1 and upgrade to make it advanced level stroke care hospital. This picture speaks a lot. You have seen that, and you can in the insert, like in the yellow circle, inside the yellow circle, you can see me in that mass. This is the reality of the country. We have got lots of challenges, but I'm sure with an enthusiastic and motivating people like you all, we'll be able to overcome these challenges, and we will be able to provide 24/7 stroke care services all over the country in near future. Finally, I would like to thank you for working together as a stroke team, and I would like to congratulate Professor Sanjeev Sharma, Professor Robin Maske, and Dr. Bpkihs for creating stroke unit in one of the most needed area of the country, that is our Bpkihs. So at the end, I would like to congratulate Dr. Bpkihs and team for taking an initiation in such a wonderful way to raise the awareness. And actually I wish I could participate in that rally, which I'm always fond of. And this actually reminds me of those days when I used to work with Professor Sanjeev Sharma and go to different wards, different places of Dharan, raising the awareness of kidney disease, and at the same time telling them the importance of cardiovascular risk factors, and supporting KSDC program in Bpkihs. I wish all of you good luck in your future endeavors, and I'm sure that we'll work together in future, not only in the field of stroke, but in the field of other diseases, to reduce the burden and mortality related to all other communicable and non-communicable diseases. But please do remember, history of World Stroke Day celebration actually began in Bpkihs. Thank you so much. Happy World Stroke Day, and congratulations all of you. Thank you.